It's me, Neleva Hidayat, the host of the show that you are watching right now. We are Dear World Live, and we are thankful to you for joining us. This is a product of Doha Debates, and we are, of course, all isolated during lockdown in the time of the coronavirus, but we're isolated together, and that is something. Each week on Dear World Live, we try and bring you unpacking of different aspects of how the coronavirus has changed all of our lives and is going to continue to do so. And this show, this program, this episode is no different. Today, we are going to be trying to tackle and understand how the coronavirus pandemic is affecting our mental health and our well-being. We'll also be trying to understand how the pandemic and the resultant lockdown is affecting people who are already dealing with mental health issues. We'll be trying to understand some practical strategies of how we can cope in this very tumultuous and difficult time. And most importantly, what we can do for each other, how we can help one another cope with the difficulties of living through this pandemic. I will be talking about mental health and well-being with my three guests, my three excellent guests who I'm so excited to introduce to you. But you're also a guest on the show, and your view and your comments and questions are more than welcome. So wherever you're watching us, on YouTube, on Facebook, on Twitter, welcome to the show. And remember, you can always get in touch with us. There's a comment bar that you can write your questions, comments, thoughts, and suggestions. But more importantly, tell me where you're from. Where are you joining us from in the world right now? Say a quick hello and let me know that you're watching the show. If you have anything that you want to say in this important episode about mental health in the time of the coronavirus pandemic, get it into us. And if you're watching us live, we will put as many of your comments and questions into the show. If you're watching us after we've broadcast, we will try and answer you there as well. This is a global discussion, and we hope to continue to have it after the show is broadcast. Okay, I just want to take a second to just say, personally in my life, I have noticed that the lockdown that I'm living through, just as a human being, is affecting me, my mental health, and the way I see and experience my friends, my family, my colleagues. It seems to be stressing and making everyone a little anxious, all in different ways. But definitely I can feel a change in the way that this is affecting all of us. And the resultant economic effects of this, the huge economic problems that we're going to be facing in the coming years, this is all pressure. And the future looks more uncertain than ever. All of this is playing on my mind, just me. But I'm sure it's playing on yours as well. So get in touch. Let me know what you think. As ever, get involved with Dear World Live in the comments section. But I want to understand what this moment, what we're living through, is going to do on all of our mental health collectively. So who better to do it with than my astonishing three guests? I'm joined today by Sukila Jawad, an Emmy award-winning writer, speaker, cancer survivor, and the creator of the Isolation Journals, a global movement cultivating community and creativity during these difficult times. She wrote the acclaimed and absolutely excellent, I love them, New York Times column, Life Interrupted, which chronicles her journey with leukemia through her 20s. It is brilliant. Please check it out. Dr. Kamran Ahmed is a psychiatrist and filmmaker. He's also an entrepreneur and writer on a mission to raise awareness about mental health issues and to reduce the stigma that's associated with it and encourage people to get help when they need it. He launched the Music on My Mind initiative to raise funds for mental health in the music industry. And Dr. Jan-Ammanuel is an Oxford University professor of economics and the director of the Wellbeing Research Center. His work looks at the relationship between well-being and income, productivity and inequality. He's also the editor of the World Happiness Report. We're going to get into all of this with all of our guests, but we're not alone. We've got another person waiting in the wings. Where's Dana? Dana Al-Ali is a student in her fourth year at Weill Cornell University studying medicine, and she's going to be joining me as my guest to hear what all of our speakers have to say. Thank you all. Now, we are spread across the world. You're all joining me from various time zones. It has been a feat to actually make this thing work out. We've got someone from Sydney, from Oxford, from Qatar, and the United States. And we're all obviously physically distant from one another. But in the half an hour that we have together, I'm really hopeful that we can come together and figure this thing out and try and find solutions to so much of what is happening right now. So thank you to you all. Let's crack on. Let's get on with it. I'm going to come to you first, Dr. Cameron. From your perspective as a working psychiatrist, what are the effects that this truly global pandemic is having on people's mental health?
Well, I'm absolutely seeing the effects of the pandemic in my work as a psychiatrist. There's a lot of fear and uncertainty around because of coronavirus. And those are the ingredients for anxiety, really. So, for example, when I've been on call, we've had patients coming in who are sort of severely anxious about catching the virus to the point where it's brought them into the emergency department. Another big challenge, as you mentioned, is, of course, living in lockdown, and that's really taking its toll on people's mental health. I've also seen people who are really struggling with that, the negative thoughts that they're getting, when they're spending all that time alone. So that's a real challenge. And then, of course, the economic impact that you also mentioned. So, I've had patients who've been feeling suicidal after they've lost their businesses and come into the emergency department because of that. So, yeah, it's having a range of effects. And also, of course, there's a lot of grief that's going with the pandemic. People who've lost loved ones, but also the loss of freedom, the loss of jobs. So there's a whole range of effects that we're dealing with, and we're certainly seeing that through our work as well.
Absolutely. And it's the fact that there's a twofold effect. There's the result of the pandemic itself, the fact that we're dealing with losing loved ones, we're dealing with people who are very sick and almost debilitated, and then the wider effects, the ripple effects of that. That's why I want to bring in Dr. Jan. Your research looks into well-being and happiness. Professor, what's your assessment of what impact the pandemic and the lockdown that's a result of it is having on our well-being? And also, can you just define well-being to us?
Oh boy, that's a difficult question you're throwing at me there, because obviously philosophers have been breaking their heads on defining happiness and well-being for probably well over 2,000 years. So I think in a very broad sense, well-being is about how we are doing as individuals, as communities, and as societies, and especially how that makes us feel more generally. And that's exactly what we try and pick up when we do these data surveys. And so everything that's been said so far resonates very strongly and is beautiful qualitative evidence of why mental health and well-being are much put under pressure in these last few months. But what we tend to do as data scientists is to try and put data behind this as well and see on a large scale, what are we seeing? And so we've been tracking data for quite some time now, also as recurring as possible as we can possibly get our hands on data throughout the corona crisis. And I think your team at Doha Debates has kindly prepared an infographic of some of the data that we're picking up. And so I can share lots of data with you, but I've chosen the one here from YouGov, which is a UK weekly tracker, which I think presents the data or what we're seeing in terms of mental health and well-being best, although it's corroborated in other data sets and across different societies. I think the main takeaway is exactly what you've highlighted, both you and the other panelists, is that we are currently at a much lower level of well-being than we typically are. So we're well below our baseline levels of happiness and well-being, if you will. But that's the main takeaway. But there's a number of other interesting dynamics going on in terms of our well-being and mental health, which is also to note that while we're lower now than usual, we have already partially recovered from an even bigger, steeper drop that we saw early in March. And so I think what's happening here is that we've moved into the new normal, but it's that uncertainty, the anxiety of the in-between period prior to lockdowns being imposed, prior to there being clarity and a certainty around this that has really has been most damaging, and we're just partially recovering from that.
I draw some hope from that graph because it shows that despite how low it got to on the date you mentioned, that there is some pickup, that there is opportunity for people to perhaps cope and deal with this. And hopefully you will help us understand how we can do more going forward. I want to bring in Suleika at this point. I find you absolutely astonishing. If people haven't seen it, they should go and check out your TED Talks already. But you were diagnosed with leukemia at the age of 22. And for years, you received treatment. I'm very happy to say that, thankfully, you're now in remission, which is amazing. But you spent a lot of your 20s in a hospital bed. So I imagine you're no stranger to isolation or quarantine or lockdown. Can you tell us a little bit about what that time was like and how it relates to what you're trying to do now?
Thank you, Nell. So when I was diagnosed with leukemia, I pretty much immediately entered the hospital and lived in a state of medical isolation, not so dissimilar to the one that we're all experiencing now. I had limited access to the outdoors, and anyone who came in contact with me had to wear a mask and gloves. And of course, these were things that at the time felt difficult to explain, but of course that we're now all familiar with. But I think what was most surprising to me was that the biggest challenge wasn't the physical ailments that came with my treatment, but the imprints of my illness on my life, on my relationships, on my career, and of course on my well-being and mental health. And so since then, I've been fascinated and have made a study both through my own stories and the stories of people in my greater community about how it is that we cope within these life-interrupted moments. And for me, one of those ways has always been creativity. I think survival and certainly isolation necessitates a reimagination of so many things and becomes its own kind of creative act, whether it's trying to find workarounds when you're working from home, or whether it's having to pivot to a different lifestyle altogether. And that's something that I've been watching unfold in the lives of so many of my family members and members of my community right now.
Yeah, I mean, you feel it too, right? The fact that almost the air feels different. I mean, Dr. Jan was talking about just the fact that this is a collective thing we're experiencing all together.
Exactly. Well, and I think that's this sort of strangeness, but also the weird beauty of this moment. Right, we are all of us are isolated, but we're very much experiencing this collectively together.
Absolutely. I want to see if I can bring in Dr. Cameron at this point. This is absolutely a tumultuous time, and you have a really unique and privileged position to be able to help so many people in the way that you have been. But I wonder how it compares to what life was like before the pandemic, and really genuinely, like, how are you dealing with it? How are you coping?
It's really interesting what Suleika was saying about creativity, because I've certainly noticed, even on my Facebook timeline, a lot of people are being sort of involved in creative projects now, and that's certainly a way that people deal with difficult circumstances. So in psychiatry, we have this idea of defense mechanisms, which are basically unconscious ways of dealing with difficulty, and creativity is one of them. We call it sublimation, which is the kind of broadly any creative act. But altruism is another one. So healthcare professionals, I think, will often have that as one of their go-to defense mechanisms. So certainly, I'm finding the fact that I'm able to help people during this time helpful for me. And I think that's something that people might want to try themselves, or I imagine people already inclined towards doing that, already helping others as a way of helping themselves through this. So yeah, it's actually, I'm glad to be able to help right now.
That's really, really sweet, actually. Sorry, I know I'm trying to be professional here, but it's lovely to hear you talk in those terms. And your work is being affected as well. So you're not able to see people face to face as you often would. Where are you working at the moment? How are you dealing with the job? So
at the moment, there are a number of changes that have gone on at work. One big one is that we're trying to move everything to telehealth. So we're doing appointments by telephone as far as possible. And there's a big project going on where we're trying to move our appointments to video conferencing. So we're sort of mapping out which patients need devices, who needs training, as well as setting up the sort of appropriate equipment for staff. And so, yeah, it's kind of a large scale project, which would normally take months, I imagine, if not years, but we're sort of trying to rush it all through in weeks if we can. So that's been pretty busy. And also, we're trying to split into teams where possible and work alternate weeks on site, because if someone catches the virus and that potentially spreads amongst people they're working with, then they could all have to self-isolate, and obviously it'd be a really difficult time for them. But it would mean that they wouldn't be able to come to work. So we've split into two teams working alternate weeks, just in case one team has to cross cover for the other. So yeah, there's a bunch of things that we're doing, but I think everyone's dealing with difficulties at the moment, and yeah, similarly in healthcare. But yeah, we're kind of all pulling together, which is nice. So the morale's really high.
One thing that I don't know if you have there in Sydney at 10 p.m. at night, which is, well, nearly 10 o'clock at night where you are. But in the UK here, every Thursday around 8 o'clock, we all get together and we clap for the National Health Service, all the care workers, all the essential workers. And for me, it's so cheesy and corny and terrible, but just standing there with my little pots and pans and banging them for a few moments, it just feels like as though we're suffering together, but we can also come together and recognize that, and that recognition is so important. But I want to go quickly to Dr. Jan, if I might. Amongst other things, there's like a link between happiness and income, and that people's incomes, people's livelihoods have been affected just tremendously. Let's take an example of the US Labor Department statistics that came out on Friday, that 20.5 million people have lost their jobs in April in the United States alone. And this economic devastation isn't just specific to America. It's happening from all over the place, including all the places my wonderful viewers and audience are watching us right now from. This is going to continue. The economic fallout of this pandemic is going to continue for years. We know that now. So I want to understand from you, how is this going to affect us and our mental health and well-being wherever we are in the world?
And wherever we are in the world, being made redundant, as the English tend to call it, which is probably a very poor choice of words in this case, is felt all across the world in the same ways. And what's critical here to understand this, it's not just the income losses that matter when people are being made redundant. What really matters, and what explains about half of the drop in well-being from being made redundant, is a loss of routine, a loss of self-esteem and social identity, and especially also losing a big chunk of your social network, which you tend to get through your work and work environment. And so I cannot stress enough the importance of trying to keep people in their jobs. And so, for example, one has to commend the Chancellor of the Exchequer here in the UK for putting out a job retention scheme and throwing lots and lots of money at it, which is much more geared towards trying to keep people in their jobs and having also the non-pecuniary aspects of a job maintained. Whereas if you look, for example, at the United States, where they've essentially just tried to replace lost income by sending $1,200 checks to people, you find that that's more geared towards maintaining purchasing power, but not necessarily maintaining the well-being of people who are losing their jobs.
And I really want to get into that as well in a moment, about how governments and policymakers, legislators, what they are prioritizing in a moment with you. But I'd like to bring in Salika here. Losing your job, Salika, as Jan has just been talking about, is devastating. I mean, I've been through it before this pandemic, and we can call it being furloughed, we can call it being asked to work from home or whatever. What have you learned from your experience? Because you worked through cancer, through illness, through strife. It's astonishing to me. What have you learned from your experience that might help people get through this really tough time?
I loved what Dr. Cameron said about creativity and altruism being antidotes to isolation and things that help our well-being, not in a sort of woo-woo way, but in a way that I have learned and seen firsthand. And so for me, I've always been interested by work that lives at the intersection of those two things. So after having to leave my home in Brooklyn, which has quickly become the hotbed of the pandemic and being in self-quarantine because I'm still immunocompromised, I started to think about how I might take some of the experiences that I had had around isolation and my own experience with leukemia and some of the things that I learned around along the way and share that with a larger community. And so that's how I came up with this idea of the isolation journals, which is a daily creativity project that's going to last for 100 days. And that's free and accessible to all. And what I did was I reached out to some of the most inspiring artists and writers and musicians and frontline workers and small business owners and asked them to each contribute a journaling prompt. And it's been pretty extraordinary. Of course, it doesn't solve these questions of unemployment, but I think within our own small way, trying to create something that offers people an opportunity to acknowledge the suffering, to express it, and to commune around it has been my way of always puzzling through difficult moments. And my hope is that it might be helpful to others in this moment, especially for those who are at home and are not able to go to work. And here in the US, especially in New York, won't be going to work anytime soon.
Absolutely, and I think there's a steady theme coming through this discussion on Dear World Live at the moment about how we can cope in positive ways and not just dealing with stress by ourselves, but there's something we can do together. And together we are. Thank you all for tuning in and watching us right now. I'm so thrilled that you could be with us on this episode of Dear World Live that we are broadcasting to you wherever you're watching, on Twitter, on Facebook, and on YouTube. You are all welcome to the discussion. Let me just take a moment to thank so many of you watching in Nigeria, in Canada, in Algeria, in Ghana. Thank you to those of you who are tuning in from Afghanistan. Mustafa is watching in Afghanistan at the moment. Abdullah Tom is watching. Thank you. There's too many comments for me to be able to name check every one of you, but we've got people here to take part in this absolutely, truly global discussion. And remember, please send in your questions about mental health in the time of the corona pandemic. What are you worried about? What is upsetting you? What is stressing you out? We've got our wonderful guests that we can put your questions to. And of course, Big Joey from Ireland has just chimed in there. So thank you for watching, Big Joey. But what is concerning you? Sending your questions to me right now. Joining me today in this discussion is Suleika Jawad, Emmy Award-winning writer and the creator of the Isolation Journals, which she's just been talking to us about. Dr. Jan-Ammanuel is the director of the Wellbeing Research Center at the University in Oxford. And Dr. Cameron Ahmed is a psychiatrist and writer. Truly global guest panel we've got here in the United Kingdom, the United States, and Sydney, Australia, of course. But we're not alone. We're joined by Dana Al-Ali in Qatar. She is a fourth-year medical student at the Weill Cornell Medical College. Dana, I'm coming to you next. But before I do, I want to take a second and talk to you guys watching me right now. I hope you're okay. I hope you're coping. I hope you're dealing with it. But it is not easy for any of us. And I just want to take a second to say, if you're watching this and you are not feeling yourself, if you're feeling any of the things that we're talking about, anxious, stressed, depressed, or just not yourself, please talk to someone. There are resources, there's help available wherever you are in the world. It will be impossible for me to mention what is available where you're watching, because there's so many of you watching from all over the world, from India, from Kenya. There's a lot going on, but please remember there's a resource out there for you. For example, there's one that we found. If we can put up the graphic here, the World Health Organization website has some really useful, actually, mental health advice to help you maybe understand why you're behaving in ways that you can see and maybe behaving in ways that you can't recognize or understand. It's a really useful tool. So get on there. The website is there for you to see right now if you need some help and advice. But your country's government websites will likely have mental health advice and also hotline numbers and resources. So please check that out. Whatever it is, however you're feeling, please talk to someone. That's really an important thing to say right now. At this point, I'd like to go to Dana in Qatar. There you are. Dana, you've been listening to all of this. You're a medical student and you're actively working right now at the front line when it comes to the coronavirus pandemic. What are you seeing and what are you experiencing during lockdown in Qatar?
So I'll be honest with you, as a student, it comes with a lot of difficulty having to face a lot of uncertainty in terms of our academic career. Many people are graduating in my age and not having a graduation ceremony, a milestone that many of us consider as a stepping stone towards a new life, a new career, is very saddening, to be honest. I see a lot of emotions among my friends, and not being able to share it amongst each other and among their families, something that has been affecting them quite a lot. I have to be honest that having a support system at this time, as you mentioned, talking to people has been quite an aid for all of us having a lot of mental health issues during these times, feeling suffocations in our house and all of these things. But I actually wanted to bring up in relation to this idea of family and the idea of a social support system. Although they are a protective factor for many of us, they help us talk, they help us perhaps, narrow down our thoughts and try to core them along our way. But also, some people have found that there's increased conflict among families and relationships are being strained. If some of the guests can please address as to why, strong relationships previously are currently being strained because of quarantine.
That's an absolutely excellent question and an excellent point. And Dana, I want to thank you for the work that you're doing as a student as well in Qatar at the moment. I want to open this discussion up to all of my guests. If we can get everyone on the screen all at the same time. Okay, Dana just asked a really important question, and it's being echoed in so many questions and comments that people are writing in right now. Celine is having personal issues. Vivian is joining us having personal issues. We've got people who are talking about relationships that have lasted for 40, 50 years, breaking down during this pandemic. So I wonder, maybe Dr. Cameron, if we can come to you first, but please address the whole group. Why is this happening?
I think, well, with lockdown, because you're spending so much time with the people that you live with, that can lead to a lot of conflict. And you can imagine, normally in our day-to-day lives, we'll spend some time with the people that we live with, but then we'll spend time away from them as well. So we're not kind of in each other's spaces all the time. Whereas in lockdown, that changes. And certainly there have been a lot more conflicts and relationship issues. Sadly, there's also been sort of a rise in domestic violence in some places. And we're also, we don't have the usual coping mechanisms that we would normally have at our disposal right now. So let's say if someone would ordinarily go for a walk or go out with their friends to deal with stress that they might have in their relationship, they don't have that opportunity right now. So that does present challenges, absolutely. I think as with, as is usually the case, the best way to try and resolve all that is through communication. And of course, tempers can flare when you're in a confined space with the same people all the time. Talking about those feelings can be really helpful, as well as doing the other things that we know help when you're in lockdown. So, for example, if you've got a routine to your day, that will help you maintain your mental health, because at the moment, there are so many things in our lives that we have no control over. If you have a sense of control over your day, then that helps you feel more grounded. Getting exercise, that can be really helpful for you. It helps release endorphins and improves the activity of serotonin in your brain. Both of those will improve your mood. A healthy diet, a good night's sleep. If you're doing all those other things, perhaps you'll be less inclined to have sort of conflict with the people that you're living with.
Does anyone else want to come in on this at this point?
Well, maybe very briefly, again, backing up the wonderful qualitative evidence that Dr. Cameron is suggesting, we find the same thing in the quantitative data as well, of course, an increase in fact, a doubling of calls to domestic abuse numbers. And one of the questions that's come up to us now also in the chat function is, what if you recall the graph I showed you, we may have gradually recovered from the big drop prior to lockdown, but we're now a month and a half in, and you see we're now at an inflection point. We're sort of muddling through, and I see the first signs of us pointing downwards again to potentially a second drop in terms of well-being, and that is partially driven, I think, of people being fed up and anxious and strained relationships.
And the other thing,
Niloufar, I do want to say one thing. We focus now on the strained relationships, but we should also, and this can perhaps help these people, remember and recognize that some people are alone. So there's a lot of social isolation, and so even if you're in there's flares and tempers from time to time, we should recognize that may still be slightly better than being left to your own devices and under lockdown by yourself.
Absolutely, yeah. I was just going to absolutely agree with jan-ammanuel there, which is, the challenges of being alone in lockdown are pretty significant as well. So a lot of people who really struggle with negative thoughts, especially if they have a very loud inner critic. So your inner critic is that voice in your head that tends to put you down for no apparent reason. And everyone has one, but it sort of differs in volume from one person to the next. And that voice is usually formed from your early experiences. So things that might have happened when you're a child, or if your parents were particularly critical. And then later on in your life, it keeps firing these negative thoughts at you. So you can imagine if you're spending a lot of time alone, that becomes really burdensome. But there are things that you can do to try and address that. And I would really encourage people to take this as an opportunity to sort of challenge that inner critic if it's giving them a hard time, So if it's telling you things like, oh, you're a failure, or nobody likes you, or whatever it is that your inner critic happens to say, you can start looking for the evidence for and against that. It's a technique that we use in cognitive behavioral therapy, where you weigh up the evidence for and against a thought, because your inner critic tries to convince you that these thoughts are facts, but really they're just ideas. And like all ideas, they should be tested out. And you can eventually, after you've weighed up the evidence for and against these thoughts, you can eventually discredit your inner critic, and you realize it's kind of talking nonsense because it's got such a blinkered view. And that can be a really useful exercise, and even when lockdown's over, it can really sort of hold you in good stead because your inner critic's holding you back in life. So
absolutely, there's some practical advice there for those of you who are watching us on Dear World Live. For those of you joining us, thank you. Remember, send in your questions. Is there something that's bugging you that you really want to share? Or we have a qualified psychiatrist, we have a public health official, and we have people who are working as activists in this space right now joining us. So please make sure you get in touch. I've got a question here actually that I'd like to throw open to my guests. This is from Sharia in Calgary in Canada. I think this is one that might work for you, Dr. Jan, but let's see if anyone else wants to chime in. Sharia wants to know, have governments overvalued GDP? That's the gross domestic produce of a nation, the wealth of a nation, opposed to other indexes, other ways of assessing well-being. And has the decision been a factor in the government's early reluctance to act decisively against the spread of the virus? Do you want to get in on that first, Dr. Jan?
Absolutely. What a great question. And needless to say, I couldn't agree more. I'm very much part of what we call the Beyond GDP movement. And the question here came in from Calgary, Canada. So wealthier nations, such as Canada and the UK and the US and many others, think of the OECD nations. At this point, income growth for the sake of growth, so just driving GDP for the sake of driving GDP, is no longer a guarantee that it translates into greater well-being. In fact, we're seeing drops at very high levels for a number of reasons. And so governments need to step up their game and think more holistically about well-being and what ultimately matters to their populations. And that means an inclusive growth, a sustainable growth, and one that caters towards social relations and building social capital in our societies, because that's been very clear throughout this episode. It's ultimately what matters is strong social ties, quality relationships. And that sometimes income and GDP get in the way of that.
Zeka, do you want to get in on this at this point? Suleika? What are your thoughts on the fact that governments and societies might be prioritizing?
Is that for me?
Oh, yeah. Yes. I just like, through your experience, and you're so active within this community and trying to get people through creativity to engage with a lot of what's going on. I wonder what your experience is when you see governments and people in press conferences in front of huge press audiences talking about the economic health of a nation more than anything else? I mean, what do you feel about that?
Mm-hmm. So, I mean, I think we live in this cult of positivity, which can be helpful up to a point. We want to demonstrate progress, especially now as we're beginning to talk about themes of re-entry and and Jan, as you said, a new normal. But I think it's important to recognize the in-between place that we are in and that we will be for a long time, and to recognize the ways in which the imprints of an experience like a global pandemic remain and will remain long after the crisis is over. And for me, just yesterday, actually, our creativity prompt was from a small business owner who had to close her business. And she invited us to reflect on the humans behind the storefronts and to write a letter or to figure out what one could do, even just in this, even if you don't have the possibility of donation, just to offer morale and support. I have heard from so many people around the world who are struggling in very real ways, especially brick and mortar shops. And I think we can't underestimate the sort of long-term fallout that's going to result from this, and the need to also give people space as we start to talk about signs of progress and of hope to express and give language to the very real hardship that so many are experiencing.
Absolutely. I will now take a few more questions from our wonderful viewers who are watching on Facebook, Twitter, and YouTube. You are more than welcome. Thank you for tuning into Dear World Live, where we are tackling the impact of the coronavirus on mental health around the world. Our guests and speakers have been talking about the various ways that we can cope, how we can help one another, and the different outlets we might have at our disposal. But I want to take some of your wonderful questions, and I'm thankful to you for sending them in and all of your comments. We will try and get as many of them into the next sort of 10 minutes of the show that we have left. But if we can't get to your comments or your questions now, as we are live, we will come to it after the broadcast if we can. So let's get back to my panel, and I want everyone to join in on this. We've got a wonderful question from Abdullah Tom in Dubai. And this is one to, I think, Dr. Jan, but again, please, everyone can join in at this point. Abdullah says that that's a very interesting graph you showed. You showed a graph of how happiness and scaredness is kind of all over the place at the moment, and definitely lower down than where we would want it. But he asks, that's a very interesting graph. How would you expect the graph to change over the next couple of months as the economy is deteriorating globally, affecting jobs and income? And then we've got another question from Twitter from Pakistan. Maqsood Chowdhury asks, I feel as if I have become useless. I am at home and doing nothing and being cut off from playgrounds, offices. What's the solution and how to cope with such mental condition? My guest, who wants to come in on this one?
Well, it looks like there's two big questions. Maybe I can try and take the first one about where I see the data and our social well-being going. Then maybe others can pick up on the more personal question. So I couldn't agree more with Abdullah from Dubai, and that is that if you look carefully at the graph, you see that we're now at sort of an inflection point. So in the first month following the lockdown, people quite quickly essentially adapted, which is one of the psychological dynamics of well-being, that we do adapt to situations. We're quite resilient as human beings. But if you look carefully, you see in the latest data that are coming in now from the last 2 weeks in May, you find that we're sort of coming to a bit of a halt in that gradual recovery, and are now potentially looking at a fall again. And I think that's because people are now coming to terms with the idea that this is not going to be a V-shaped recovery. We're not just going to sprint back to the old normal, and that things are going to linger much longer. And people are getting, again, fearful and worried and scared about what's in store for them in the next few months. And again, government is not quite clear on it. So while government came in with lots of clarity towards the second half of March, saying, okay, now it's lockdown, we're all in this together.
Yeah.
And the guidelines are very clear, which is helpful for people because it brings psychological stability. Now, and we had Boris Johnson's speech on Sunday, and the overwhelming consensus of the people listening to that speech is that, well, it's not quite clear. What are we supposed to do? Is this really lockdown or lockdown-like? Can we go back to work? Can we see our family? Yes, no. And these questions are, again, raising sort of uncertainty and psychological instability. And I think we're going to be seeing a gradual decrease again in our mental health and well-being as this continues to linger, and it continues to linger with less government guidance and clarity about what to do and what's right and what's wrong.
Yeah, I think that's a really important point. I wonder if I could just mention on to do with how the economy is declining and how that's going to affect mental health in the medium to long term. I think, from a clinical perspective, like I said, we're already seeing people coming into the emergency department feeling suicidal because of the economic effects. And, I think after the global financial crash, there was something like 10,000 or an estimated 10,000 additional suicides across Europe and North America. So the economic effect really shouldn't be underestimated. But I think what really needs to happen is governments need to invest in mental health services to prepare them for what's to come, as well as ongoing kind of public health messaging, even things like this. And I think if we can prepare for, those mental ill effects, then I think we'll be in a good position. But in response to Maqsood's question from Pakistan, I think, I'm really glad you asked this. I'm sorry that you're going through this, but the idea, for example, that, you're feeling as though you're useless, I think that would be a really good opportunity for you to really challenge that idea, because it sounds to me like your inner critic is telling you that you're useless right now. But if you were to write down the evidence for and against that idea, I'm sure you'd be able to find some evidence for the fact that you are being useful. I'm sure you're helping either friends or family or doing something of use, and even just challenging that idea as a starting point could be useful. And then doing things like staying in touch with friends and family, doing things that you enjoy, as well as the things that I mentioned earlier, having a routine and exercise. All of those things can help maintain your mental health, and then hopefully you'll start to feel better.
That's practical advice. Write it down. Do you know, and I'll tell you this off script very quickly. 2 days ago, I had that. I was just feeling like, what's the point of any of this sort of going forward? All of it is everything just feels so temporary. Nothing feels permanent. I don't feel like my life is moving forward. I'm not making new connections. I'm not seeing friends. And I just felt really low. And I did that, Dr. Cameron. I took a piece of paper out, literally, and I wrote all the things that support my belief that my life isn't moving forward or nothing's changing and everything's going backwards, and all the things that don't. And even at the end of it, nothing changed in my life, but I felt different. And that was just such a relief to me. So this is the moment in the last sort of few moments of the show where we have a call to action. So I have a question for all of my guests, including you, Dana, so get ready. What is one specific thing that you would like to tell our wonderful viewers watching right now that they can do to make the post-corona world one that is better in terms of our mental health and well-being? And we'll do a round robin. We'll go from you, Dr. Jan.
Well, can I do one very quick one and then one a bit more substantive, but they're related. The first one is, and I want to congratulate you, Nelifar, is the following. Right at the beginning of the show, you didn't say social distancing, you said physical distancing. And I think if there's one small thing that we can all do is to change the wording away from social distancing and start saying physical distancing while staying socially connected. From a well-being and mental health perspective, the notion of social distancing could not be more poorly chosen. And in these times of crisis, we will have to rely on quality social relationships and our social capital. And so we need to emphasize that. So physical distancing is also now what the World Health Organization suggests we use, and we should all adopt that language. And then related to that, I'm hoping that in the future, people will have a renewed sense of appreciation for their quality social relationships. In the well-being and mental health science, we know all too well that what people think will make them happy, it doesn't quite make them happy at all. So people will obviously put a big weight on income, for example, but they'll underweight the importance of the quality of social relations on the job, for example, that is being looked at or considered. And so I really want people to get away with the idea that moving forward, and hopefully soon, a post-corona situation, that we reappreciate and reinvest in our social capital, and because that's ultimately what we find in the data matters most to people's well-being.
Absolutely. Thank you. That wasn't me. That was Amjad Atella, my boss. So credit where it's due. Let's move on. Suleika, what about you? What is the one thing that you would tell people that they can take away in the post-corona world in terms of making our mental health and well-being better?
Jan, I loved what you said about the distinction between social distancing and physical distancing. As a writer, I think language and the words that we choose are hugely, hugely important. I guess I would just say that in my own sort of lived experiences and through the stories that I have the privilege of hearing every day, as we kind of have made this retreat inward, I think it's of utmost importance to also pivot our attention outward on acts that we can do that live beyond our own lives and that are in service of others. I think the second piece of this that was sort of alluded to earlier is that as crucial as it is to take certain precautions like wearing masks and being conscientious of how we navigate the world and the sort of sheltering at home guidelines that are in place, it's just as important to focus and to take precautions for our mental and emotional well-being. And I think the temptation, is to focus on physical illness without focusing on the sort of more holistic impact of a pandemic like this.
Absolutely.
On our lives.
Absolutely. Dr. Cameron, briefly.
I think just a couple of practical things that people can do to manage the anxiety around coronavirus. So, of course, following the health advice that we're being given of washing your hands frequently and maintaining physical distance and not touching your face. If you're doing the things that we know will protect us, then that'll also make you feel better. Also, I think it can be helpful to limit the amount of information that you're consuming about coronavirus, because there's so much information out there, it can get quite overwhelming. So it can be worth just picking a time each day and checking up on the news and then doing other things, as well as using reliable sources of information, because there's so much misinformation out there and it's often worse than the reality of the situation. So I think those are some practical things that could help, as well as, I guess, not being hard on yourself during this time and not expecting too much, because we're going through a pandemic. It's okay if you're not being overly productive in lockdown. It's okay if you're feeling anxious. So I think just, I guess being aware that this is a difficult time.
Yeah, cut yourself some slack is what I'm hearing. Dana, very briefly from you, because we have run out of time now.
I just want to say that, people should also look into this time as a time for self-learning and self-growth. Although life may seem as if it has taken a pause in all of us, but not necessarily a pause on yourself. Try to take this time to develop a new hobby, to learn more about yourself, reflect on some of the things that you have seen in your past and your actions of the past to become a stronger person, to go into society. In fact, you as part of a community will notice the growth. We call this post-traumatic growth, a form of connectedness and togetherness, because what's unique about this pandemic is that there are no sides. We are all on the same side fighting one thing. And that's what's important, is that we are all together, and just take the time to reflect on yourself.
I absolutely love that. My thanks to all of my guests. Thank you for joining me. We've had a wonderful discussion and I've learned so much in this time. It's time to say goodbye, guests. Say goodbye.
Thanks.
See you guys. Bye. Those of you who are watching and have seen this show, thank you for sticking around. It's been a really, really interesting and illuminating one. And I have absolutely loved getting your comments and your questions. And I hope that you found this show informative. Now, remember that if you are experiencing any of the things that we've spoken about, anxiety, stress, depression, or you're just not feeling yourself, please seek some help. talk to someone. There are resources and information available online everywhere, especially if you go onto your own government's website. There's also the World Health Organization. However you need and can access help, please do so. I hope you found some of the stuff we've been talking about informative. Now, that's all from this episode of Dear World Live. We will be back next week on Tuesday, this time to talk about how the coronavirus is affecting the education systems around the world. But if you cannot wait for that, you can always tune in and watch all of our previous shows. I think we can get the link there for dohadebates.com/live. We've got 4 other episodes that you can tune in and watch. And if you can't wait for more Doha Debates content, why not check out our amazing first season of Course Correction, the podcast that I host that Doha Debates brings to you. And if you don't want to listen to coronavirus-related stuff, this podcast is for you. I think it's excellent. There's 17 episodes of the show that you can binge on right now. Until next week, until next Tuesday, I hope you're staying well, safe, and happy. I'll see you soon.